What's the best position for meditation if you have chronic low back pain or sciatica? Is it seated or kneeling? Or maybe you need a bunch of bolsters and blocks to prop you up or lay down. Or maybe you should be sitting upright with some kind of lumbar support device where you can really lock in and feel supported. Spoiler alert, it's going to depend on your diagnosis and your symptoms. Do you have a disc herniation, nerve pain, sciatica, glute pain, tailbone pain, and are you flexion or extension intolerant? So in this video, I'll help you figure out exactly which position is best for you to meditate without irritating your back pain or sciatica, because otherwise you're just going to be fighting your pain the whole time and totally defeat the purpose of meditation. Let's get started. First, in case you don't know how important meditation can be for chronic back pain and sciatica, we know that depression increases the risk of chronic back pain by 150%. High stress increases the risk of chronic pain by 180%. One study followed people for 3 years to see who would develop back pain, and it wasn't the people with the worst disc herniations or MRI findings. It was depression was actually the leading factor. Fear leads to less movement, tight muscles, overprotective muscle bracing, and one of the big goals we have with our clients is to calm their nervous system, get their muscles to relax and stop being so hypervigilant. So that is why we need to teach you how to relax your back, but you can't do that if you're in an uncomfortable position during meditation. So then it's a catch-22 because it's impossible to meditate in order to relax your nervous system, which would help your back pain, but you can't even get into the position because of your back pain. So we need to relax things in order to get the pain relief, but we need the pain relief to get to relax. And it's very difficult to know where to begin. So where to begin is finding the right position for you. First, let's talk about the problem with a lot of traditional meditation positions. We could even start with getting rid of this cushion. Actually, if I'm being real, we wouldn't even have a cushion. We'd just be on the ground and we'd be expected to be in a full lotus position, which now I don't even get into anymore because it's pointless and it just bothers my knees and hips. So there are a ton of reasons this position sucks for many people. First of all, most people don't have the hip mobility to be able to even cross their legs like this and get their knees on the ground. Most people, when they sit cross-legged, would be sitting more like this. If your knees are up here because your hips are tight, what that's going to do is force your low back into a rounded position. It's not that this is dangerous, it's just you have to kind of like use effort to hold yourself upright in this position, and it's not sustainable because you're just exerting effort the whole time. So that's going to lead to a lot of fatigue from your hip flexors trying to pull you into an upright position. So you'll get tension here on the inside of the hip, and then back tension because the erector spinae muscles are trying to pull you into an upright position. So the simplest thing you can do is just throw a cushion under your butt because that naturally elevates your hips above your knees and allows you to tip your pelvis forward, which means you can sit up more effortlessly. You could use a block instead. It works just fine. But even from this position, most people will not have the hip mobility to sit the way I'm sitting right now. And even if you do, it still requires a lot of twisting of the tibia at the knee joint to get into this position, and still great hip mobility and a good anterior tilt of the pelvis so that you can get into an effortless gravity sort of defying position where you're not feeling like you're going to fall forward, but you're also not feeling like you're slouching backwards. And beyond that, a lot of people get pressure points. If you can get your knees to the floor, you'll get pressure points underneath the outsides of your knees, or more commonly, the top of the foot. And for me, if I sit in this position too long with nothing underneath it, my toes will go numb because we're cutting off the blood supply. There's an artery that goes into your foot and it goes right on the top of the foot and it cuts off the blood supply to your toes. So your toes go numb. So the next solution is we add a cushion. These are called a zabuton or just a meditation cushion. So now anything else we do from a seated position, we can throw a cushion or some of the other options I'll show you. And now we've got more cushion for the top of the feet and the knees, way more sustainable from here. That said, all of this is probably not accessible for most people with back pain and sciatica. So we need to start giving better options. First option is if you have a zafu or a meditation cushion, instead of turning it sideways this way, you stand it tall and then you use it for a kneeling position. Still, a lot of people can't bend their knees this much, but I do want to offer one other option here. If you don't have a cushion, you can use a block and put it in this same position. Or you can take multiple blocks and stack them up and place them under your butt and then tip them forward just a little bit as you sit down. And then you can get into a really nice supported position. This is actually really comfortable. So my sit bones go right on the block. Right here, sit bones, boom, right there on the block. That said, still, most people with back pain and sciatica, this is not gonna work. So we need even better options. This is where we need to sit on something. Now, I don't have an office chair or a recliner in my clinic right now. So I'm just using a box, but pretend that I'm sitting in an office chair or a recliner or a nice supportive chair. And a good idea here would actually be to have some cushion on your chair. Like when I'm driving, I actually use a cushion from Purple, the mattress company. I love it. It's so comfortable. It feels like you're sitting on a cloud. Now, one thing you'll notice about my position right now is I'm too high. My feet are dangling, which means I'm going to cut off the blood supply to my feet and my blood can't get back up from my feet. So I need to lower the position, where if you're in an office chair, of course, you would just hit the little lever on the side and lower your office chair. But now this is a pretty comfortable height for my butt. So my butt needs to be basically in line with my knees. From here, if it's comfortable, you can literally just take your hands to your knees and pull yourself forward into a more extended position. And this is your resting position for meditation. Now, I want to make a quick note about this. You should have your feet really wide. So I know that some people hate this position because it feels, I don't know, like inappropriate or something. But the reality is, if your knees are together, you cannot tip your pelvis forward because your femur is in the way of your pelvis. So you won't be able to get into a nice neutral position with your lumbar spine. So you really do need to take your feet kind of wide and then tip your pelvis forward and sort of scooch a little bit. And I actually do like to just, kind of loosen it up a little bit, go further than I want. So I'm pulling myself further into extension than I want, and then let the body just settle into whatever feels like neutral. And I'm sitting kind of off the edge a little bit. So really just my sitting bones are on the chair. And then from here, you can have hands on the knees, shoulders back, or you can take your hands and cross them, or whatever feels comfortable to you. However, some people, when they're in a lot of spinal extension, these muscles in the back begin to cramp, they start to get glute and tailbone pain, and they really need a more relaxed position. So if that's you, then when you're in your sitting position, what we want to do, and forgive me, I don't have an office chair here in the clinic, but maybe I can put some B-roll for you. Using a chair where you can lean back, pretend this is an office chair or a recliner, or if you're using a couch, we want something where you can have a little bit of lumbar support. You'd take maybe like a throw pillow and put it under your lumbar spine, and then make sure you have head support so you can really just lean back and fully relax with no effort. This is a bad example. I would not use this workout bench because I can't totally relax. And over time, I can already feel it. My butt is digging into this area, the seam of the bench. So I'm going to get pressure points, and that's going to get really annoying. What we want is somewhere where you can totally relax. And even if that means leaning way back, like if you have a recliner and you're all the way back, and then your arms can be supported on, like you put a pillow under each of your arms. This is fantastic, unbelievably supportive. And the reason I really like this with an office chair, like an ergonomic office chair or a recliner, is because with a recliner especially, sometimes they have buttons on the side where you can push it to pull yourself back up. Because if I have really bad low back pain and sciatica and I'm in this position, especially after I've been relaxing for like 10 minutes doing a meditation, and I suddenly have to contract my core to get up out of this position, that might, piss off my back after I just spent all this nice time relaxing. So having a recliner or an office chair that has sort of hydraulics or a spring that kind of helps you get back up is fantastic. And of course, you can pick how high up you want to be. Some of you only need to lean back just a little bit, and that's fine. A lot of you with back pain and sciatica can't even get up and down off the ground in the first place. Sitting down or reclining in an ergonomic office chair is great because that's the position that most of you can actually get into. However, for some of you, you may have to do it laying down because laying down is the only position you get relief. So let me show you a couple of options from laying down. One other option from seated, and I actually kind of like this, are these lumbar support devices. Again, it's not that any of this is magic, but if it allows you to more comfortably meditate for a longer period of time without your back bothering you or your nerve pain bothering you, then that's fantastic because meditation is so beneficial for our health. So the way this works is you wrap it around your low back and it pulls your low back just like a lumbar support pillow into a more neutral or extended position. So if you're the kind of person that finds relief with like a sphinx pose or cobras or cat-cows, stuff like that, then this might be really nice for you. However, if you're the kind of person that hates spinal extension, maybe this isn't great. But I would actually challenge that because sometimes people hate being in an extended position with their spine, but it's because the muscles in their back are cramping up because they're shortened and tightened. But if we have support because the strap is doing the work for you, then you can actually relax and enjoy a passive spinal extension position, which can be really nice. Essentially, the way this works is you pull the support up to a comfortable place on your lumbar spine, you wrap these pads around your knees, and then what you do is you clip this together just like that. So it pulls your knees, it holds your knee. So this holds your knees so that they don't just flop out, and this supports the tension. And this is really nice. If you just get it dialed in and they're very adjustable, then you can kind of just like place your knees down, and it's nice because you can actually kind of like lean back a little bit. I'll show you from this angle. I can sort of lean back a little bit because the support has my back, and I can lift it to whatever position feels appropriate. I like a position where it's above the glutes but below the ribs. That's the best position for your lumbar spine. And then you just tighten it enough that you can have just a slight backwards lean while maintaining this nice lumbar curvature. And this is great because then we're not using our core muscles to hold us in meditation. The whole point of a lot of the meditations we teach are to teach you to stop bracing your core all the time. Stop tightening up your muscles all the time. That's just leading to overprotective muscle guarding and more pain. So we're trying to get you to relax. So if you find a meditative position where you can't even relax, what's the point? And that's part of the reason I hate using a ball for meditation. People say, oh, let's use a ball because it forces your core to be engaged. I want you to stop engaging your core. I want you to relax when you're meditating. So no, this is fine for other reasons, but it's not good for meditation. All right, let's talk about some options from laying down. My personal favorite, you basically just sit right next to a couch or a chair, and then you lay back, and then your butt is right next to the couch or chair already. You put your feet up there, scoot yourself into a comfortable position. Oh my gosh. And then you just let go and disappear into outer space. This is also one of my absolute top favorite ways to get people used to having a little bit of spinal flexion if they're afraid of it, because this puts them in a really safe position, and then they can breathe and relax and send their nervous system signals of safety while their body is introduced to a little bit of spinal extension. This is a crowd favorite. Now, some of you might think that you want to do a meditation where you put like a rolled up towel or something under your lumbar spine so that you have some extension and we get lumbar support in this position. But this can be nice. This can be a good traction-based exercise that feels nice, but I promise you, it's only going to feel good if you're doing this for like 2 minutes, maybe 5 minutes. If you actually do a long meditation, like 10 minutes, or, if you're really trying to put some time in and do like a 30-minute meditation, this is not going to be comfortable in 10 minutes or 30 minutes from now. So save this for like a quick 2-minute thing before you go to bed. Don't do this for your meditation. A better option would be to do a supported butterfly position. If you had a bunch of props, block at an angle, bolster to support it. So now I'm supported here and I'm supported by this block here, so it's not going anywhere. And then you can lay back over the bolster, and then you can take another bolster and then put your feet together and let your knees go wide. So you're in a butterfly position. And then if you really want extra support, you can put something under, and I actually do recommend this. We'd put like a pillow or something under each of your arms, and then we can relax here. Oh man. And this is just really nice for the right person. The person who's going to enjoy this would generally enjoy a little bit more spinal extension, again, like a sphinx, that type of thing. If you like that lumbar support, this can be nice. But take your time playing around with this. By the way, the way you would get out of this position is you don't just sit up, you would roll to the side like this. All right, that's the smoothest transition. I didn't even show you my favorite option. My favorite option is using this little fold-up kneeling meditation bench. So it's really cool. You just find a kneeling position and then open it up. You can adjust it to be higher or lower, and then you just settle in here and make sure you've got a little bit of an anterior tilt to the pelvis. That's a good thing, by the way. I don't know why everybody's freaked out about anterior tilt. Your pelvis is normally in an anterior tilt. That's just its normal resting position. And that's good because it helps facilitate a natural lumbar curve, especially when meditating. It'll be a more effortless position for most people. This is my favorite place to meditate, personally. And if your knees don't like this, they actually make like a kneeling office chair that you can use that's higher so you don't have to get on the ground, and it's super padded. So there's a lot of different options for kneeling meditation, but this is absolutely my personal favorite way to meditate. The one cautionary note that I want to make is that if you choose a laying down position, you're very likely to fall asleep, and some of you just need the sleep, to be perfectly honest, so I'm not going to give you too much shit for that. But if you're falling asleep all the time, then you're not able to practice the skills of meditation. So I would rather you have a position where you can maintain awareness while you're practicing without actually falling asleep. Because a lot of what we're doing during meditation is training your brain to be able to let go of thoughts. But in order to practice that skill, you have to be aware of thoughts to practice letting go of them, or aware of creating tension so you can let that tension go, or aware of how you have conscious control over the nervous system using breathing techniques. But if you don't get to be conscious for that ride, then you're not actually practicing a skill to regulate your nervous system. So we don't want to be falling asleep during meditation. And pro tip, and this comes from having done a ton of hours of training in yoga nidra, which is yogi sleep, where we actually we intentionally lay down for the entire meditation. And if you fall asleep in this position, what you can do is actually just bend an elbow like this and have your hand open and aware. And then what happens is if you start to doze off, your hand will drift off to the side and you'll notice it. And then you go, oh, okay, right? You go, oh, right, I'm meditating, okay. And then every time it drifts off, this way you can be in that in-between stage of I'm not asleep, but I'm very relaxed, right? This is a good pro tip. Hey, real quick, if you're new here, I'm Dr. Anthony Davis. I had chronic pain for a really long time, which is why I had to learn all of these skills of how to take care of myself and get myself out of debilitating panic attacks. And anyway, we put together a really awesome masterclass that summarizes the research on like, what do you do about chronic pain? What do you avoid? How do you put together a whole person plan that's evidence-based to get back to normal life? That's all in our masterclass, and that link is always in the description of our video. So go check that out if you want a real plan. Okay, so the main point is if you want to be able to practice relaxation, you need to find a comfortable position, but one that you're not going to fall asleep in either. I think the best option for most people is going to be finding a reclining chair, like an office chair or a recliner, where you just lean a little bit back, but you're very supported. If you start falling asleep from there, then we might want to explore maybe a lumbar support strap to keep you upright and some other seated positions. But of course, if seated positions bother you, which is very common, I'd say probably the majority of the clients that we work with, a seated position, their biggest complaint in their life is, I can't sit down for long periods of time because of my back pain. So if that's you, then yeah, you're going to have to lay down, but do the elbow thing so that you don't fall asleep. And then honestly, just experiment with a couple of different positions and see what works for you. There's all kinds of support and devices and stuff that we can use. I'm not saying you need to buy anything, but I'm just showing you what's available and what I know has worked for me and my clients and my patients over the years. Now, if you want to put all that stuff into action and have a guided meditation practice, we've got a bunch of them, but I'll put a guided meditation right here on your screen, and you can go practice some meditation right now. See you there.